那接下来呢是大家所关心的，我们要怎么样运用细胞治疗来发展多元应用，可以真的从科研、制药到走向生活，或者是透过一些特殊的原料代工的服务，来加速国内外 CDMO 的发展。所以今天我们很荣幸的可以邀请到讯联生技技术研发长 Dr. Sieber 来跟我们进一步分享从研发、制药的再生医学应用。让我们以热烈的掌声有请 Dr. Sieber。
All right. Good afternoon, my dear colleagues from Bionet, my colleagues from the medical community and dear guests, okay, good afternoon. Okay, I will talk a little bit like Shirley just introduced, okay, we're talking about ourselves now, okay. Okay, let's jump inside. Bionet has done stem cell research, mesenchymal stem cell research and stem cell cell therapy development over actually basically 20 years now. Okay, it has really started. It has started in the beginning with Wu Kangxi, right? We started with cord blood transplantation related research and then GVHD, and then later we expanded our interest. If I go closer, we expanded our interest into wound repair, wound healing, and then lung injuries. So we have accumulated quite a lot of experience, and then Teguanfa come, right? Okay. Okay, so we are very much involved in Teguanfa. We promote the application, of course. We would like to cooperate with all the hospitals, and we also promote allogenic treatments, okay, so we are in clinical trials. We have done it before and we're still doing it, okay. Now the new regulation, 再生医療三法, is just basically support what we have been doing all along. Okay, all right. Okay, so we are actually doing almost also, what I didn't mention, we're also interested in, of course, exosome. Exosome derived from mesenchymal stem cells. It will come later a little bit more about this one, okay. We have done quite a lot of cooperations throughout the years, and I want to point out there's a wound repair. This is actually the longest path we have gone, okay? When we think about, in 2007, we did the first feasibility studies with some mice to heal wounds. And then finally, we come to a complete, thorough study with animal model, and then, which led then later to the clinical trial, okay? With okay, and the results are very good, okay. And when Teguanfa came out, we of course wanted to promote more. We give a chance to more patients to use this one, okay. And then what comes next, of course, is then the application to even more patients, bring the technology to more patients. Okay, so in Teguanfa we have over 60 cooperation applications, and we have passed 7, okay? CDs here. Okay, I think there's a little bit, okay? Actually, we have 3 indications that we are doing now. One is cancer, one is wound healing, chronic wounds, and one is also arthritis, okay? Throughout the day, throughout the afternoon, you have already heard about this one, okay? So don't have to explain much more, okay? Now, last year, COVID-19 was sweeping through Asia, and we had many patients ending up in the ICU with ARDS, okay. We have from our clinical trial in ARDS some experience, and we have also a large mesenchymal stem cell bank. That gives us a leverage. We provided units to not only to Taiwan patients to treat ARDS, and we had also the chance to bring our technology and the cells abroad to Thailand. We provided them with 2 shipments of mesenchymal stem cells, okay, for the patient treatment. Okay, so Bionet can help. Never forget this one. Okay, we can do it. Okay, what goes in line actually, some units maybe don't have their own GDP laboratory or come from abroad to do clinical trial here. We offer also CDMO services. They can be from cell processing to cell manufacturing, or even MSC-derived products, cytokine or exosome manufacturing. We do product development, actually, and we can also do data analysis if it is necessary, and so on, okay. Now, currently we have several projects running with 5 international companies. Okay, so Right. Now, MSC is, we can understand them a little bit, okay? If we understand mesenchymal stem cells, we know how they act. They will secrete some factors, exosome cytokines, and we can leverage this one in different ways, okay? You can see here, we can use, I take skin as an example again. We can use cell therapy and use it on chronic wounds, for example, but we can use, like, okay, we take only the cytokines which actually act in the same way then. They transfer this one, the functionality, and we can use it in like a light laser ablation, or we can even use it for skin repair in this mention, okay? So this gives us a chance actually to separate the process and have the different, from the same technology into different ways applied, okay? Now, YMT exosomes are a hot topic, okay? But actually we have done that already several years basically, okay? With conscious or unconsciously knowing, okay, that it already happened, okay? Exosome, because MSC can work through exosome on wounds or inflammation and so on, they are biocompatible, they're non-immunogenic, okay? They can be used in many different diseases, okay? One also benefit of exosome is, of course, we can modulate the cell culture, the process, to actually get exosome with different properties, okay? So, and then there are higher technologies we are going into, okay? So we can use it, for example, in hair or even on the eye. We can use this one as anti-inflammation or a hair-promoting agent. We can use it in OA or so. It's all possible. Okay. Oh, these are the exosome moving. Okay. All right. Now, some example for this one is we can use the secretome of mesenchymal stem cells, which have anti-inflammatory properties, okay? And you can see here we have 3 different disease types: rosacea, eczema, and psoriasis. And within about 1 to 2 months, we can relieve the symptoms, okay? And this is only a topical application. It's not a cell therapy at this point. So that will be then drug application will be the next step, okay? Dosing and everything. But we can see a very nice improvement from very red to normal skin. Psoriasis is a little bit more difficult to treat, but you will have much improvements, okay? If you would like to have the exosome more like promoting collagen production, so it will increase the collagen inside the skin, and when you have wrinkles and they fill up with collagen, then the wrinkles will disappear. Okay, so this is, you can see, we can also increase the epidermal thickness, which basically gives you a nice younger skin again. Okay, we can before, after, okay. So this is another application, okay. And one more, hair. I cannot say, okay. I cannot say who is the patient, okay. Actually, hair promotion, exosome can do it. There is some technique behind, of course, to do it. We have to clean the scalp very nicely so the exosome can actually penetrate the skin with a little help of a special agent. And then we can see very clearly this new hair will appear and existing hair become thicker again, okay? So it is a very feasible application here, okay? And then for the girls, never fake eyelashes again, okay? Please use a natural growth. We can actually, it takes a little bit a while. It's not instant, but it will grow. You can see this person has 3 millimeter extended the lashes. And the good part is actually they also last. So it will not just disappear again. Okay. Yeah. All right. Now, when we are from autologous use, okay, and then we want to use it in an allogenic way, we are moving towards a product. We have a new regulation, right? Like机制管理条例, okay? We have to go through higher regulatory requirements, okay? We have to move from GDP to PICS GMP, but we can have then an allogenic product and it is then ready to use. We also heard it today already, ready to use in some indications, like ARDS. You cannot wait until you have your own cells grown. You must have it immediately. Here makes the product much sense, actually. And it will be then a nice product. So this is what we are working on. Of course, we would like to have a product and we increase our spec. Oh, yes. So now this is an overview of what we are doing clinically. Okay, so we can use our stem cells from very small children. We have used it, for example, and to children with GVHD, and then we can have it to adults. Okay, adults would be then osteoarthritis or then the wound healing process that we have. Okay, and very important now for us is the lung injuries. Okay, we have the acute injury, that would be ARDS, or we have the chronic, that is lung fibrosis. This is our direction where we are going. Okay, and also important is kidney disease, chronic kidney disease. One out of 10 people will have that in Taiwan. So we also focus on this one, this part. Okay, so this is gives us now overall the application of mesenchymal stem cells from a very small person to a very old person. Okay, and we can everywhere apply this one. Okay, all right. In our company, we have two segments basically, which make up a whole precision health management. Okay, on the one side we have our cell therapy and regenerative medicine. That means we have our the stem cells, the cord blood, for example, and the mesenchymal stem cells. We have the immune cells and CDMO services. They will give us the life substance, right? So we can say it. And on the other side, we have then the information, the genetic information, health and medical information that comes together and becomes a different kind of database. And all together combined, we can make a better health management overall. Okay. All right. I think I'm quite quick. Okay. I was worrying I was talking too slow. Okay? All right. Thank you very much.
谢谢 Dr. Sieber 这么精彩的分享，让我们看见讯联生技深耕再生医学22年，持续不断的创新跟突破。那也期待呢，所有生技领域的专家，我们可以持续用高品质、高安全的坚持，来带给我们的民众更安心、更好的服务或者是产品。